It's Zoya, Z-O-Y-A. Today we'll do a physical examination and some lab tests, just routine things requested by your employer. There is one other item. Have you ever been screened for hepatitis B?
What is this? I don't know this.
Hepatitis B, it's also called HBV, is a virus that causes liver disease. It's very common in the Ukraine among the general population. The Department of Health recommends one-time screenings for all people whose countries of origin have a high amount of hepatitis B, such as the Ukraine.
You said HBV. Is this like HIV? This is from sex?
Outside the U.S., the most common route of transmission is from mother to child, typically during birth. It can be transmitted other ways, including through sexual contact, but mostly it's transmitted from mother to child.
This makes no sense. My mother had it. My mother is well. So am I. And I do not get from sex. This is not appropriate to say.
Again, I hear you. I should be clear. What I'm saying is that hepatitis B is very common in certain regions, like the Ukraine. Most people who have hepatitis B don't know they have it. They may look well and feel well for years with no symptoms, but eventually, if left untreated, it can cause liver disease. Again, it's most often transmitted from mother to child, typically during pregnancy, birth, or soon after. It's not necessarily related to what you might call bad behavior, such as drug use or having many sexual contacts. The good news is that we have very effective treatments for hepatitis B that can greatly reduce the risk of liver disease.
And the government wants to know if I have it?
Again, I should be clear. The U.S. Preventive Services Task Force is a part of the Department of Health that makes recommendations about public health. They recommend screenings for HBV based on country of origin. They do not collect any information. Only you and I will know the results of your test.
And my employer, will they know?
Well, they don't specifically request the results of the test, so no, they won't know. Your test results will be entirely confidential.
I don't understand the need for this, but you say it's important.
Yes, it is. Hopefully you've not been exposed to hepatitis B, but if you have, the treatment can improve and extend your life and possibly prevent transmission to someone else, like your own kid if you choose to have children someday.
Okay, we'll do the test.
Good.
Thank you.